Have you noticed a recent surge in respiratory illnesses around you or in the news? It's something that's hard to overlook. We are witnessing an upswing in the number of respiratory illnesses, and it's a situation that's causing concern worldwide. In numerous regions, people are falling ill with symptoms that are often mistaken for a common cold, but the cough lingers, creating discomfort and worry. This lingering cough is not just an ordinary symptom, it's an indication of a respiratory virus that's currently on the rise. The affected areas are widespread, spanning across different continents and countries. From bustling cities to quiet rural communities, no place seems to be immune. The duration of the symptoms varies, but what stands out is the persistent cough. It seems to hold on, often for weeks, long after other symptoms have subsided. The number of people hospitalized due to these respiratory viruses is also increasing. Hospitals and clinics are reporting higher admission rates as more and more individuals are needing medical intervention. It's a rising tide that's putting a strain on healthcare systems and causing alarm among medical professionals. But it's not just about the numbers, it's about the impact on people's lives, the disruption to their routines, and the anxiety it brings. It's about the lingering uncertainty, the unanswered questions, and the search for solutions. Now you might be wondering, what's causing this surge? Is it just the usual flu season, or is there something else at play here? Well, that's what we're going to explore. We'll delve into the specifics of 3 major respiratory illnesses that are currently prevalent: COVID, flu, and RSV. Now that we've set the stage, let's dive into the specifics of 3 major respiratory illnesses: COVID, flu, and RSV. COVID, flu, and RSV, 3 names you've probably heard quite often lately, but what distinguishes each of these illnesses? Let's dive in. First up, we have COVID-19, a novel virus that took the world by storm in 2020. Its symptoms can range from mild to severe, affecting different people in different ways. Common symptoms include fever, cough, and difficulty breathing. However, it's also notorious for its unique symptoms like loss of taste or smell. COVID-19 spreads primarily through droplets from coughs or sneezes, but can also be picked up from surfaces. Next, let's talk about the flu, also known as influenza. Though it shares some symptoms with COVID-19 like fever and cough, it often comes with its own set of signs like body aches, chills, and fatigue. The flu is a seasonal virus and it's highly contagious, spreading similarly to COVID-19 through droplets when people with the virus cough, sneeze, or talk. Last but not least, we have RSV, or respiratory syncytial virus. This virus typically causes mild cold-like symptoms but can be severe for infants and the elderly. Unlike COVID-19 and flu, RSV symptoms include wheezing and a runny nose, and it's also less likely to cause a fever. This virus spreads through droplets, but also from touching a contaminated surface and then touching your face. All 3 illnesses can range in severity, from mild symptoms that can be managed at home, to severe cases requiring hospitalization. While they may have overlapping symptoms, the differences can be found in the unique symptoms they each present and how they spread. Furthermore, it's important to remember that while vaccines are available for COVID-19 and the flu, there is currently no vaccine for RSV, which makes prevention measures such as hand hygiene and avoiding close contact with sick individuals critical. Understanding these differences can help us take the necessary precautions and seek timely medical care. Knowing the symptoms of these illnesses can be the first step towards effective treatment. The common symptoms among COVID, flu, and RSV include a persistent cough, fever, body aches, sore throat, and fatigue. However, there are subtle differences too. For instance, COVID might present with a loss of taste or smell, while RSV tends to cause more severe symptoms in infants and elderly, like difficulty in breathing or bluish skin color due to lack of oxygen. Home treatment can be effective for mild symptoms. Rest, hydration, and over-the-counter medications can help manage fever and body aches. But it's crucial to monitor symptoms closely. If the cough persists for over a week, or symptoms worsen, like shortness of breath or high fever, it's time to seek medical care. Particularly in the case of COVID, if you're experiencing severe symptoms or belong to a high-risk group, it's advisable to get medical help immediately. This could include people over the age of 65, those with underlying health conditions, or anyone with a compromised immune system. Remember, when in doubt, it's always safer to consult a healthcare professional. This surge in respiratory illnesses isn't just a local issue, it's a global concern. Around the world, nations are grappling with this rising tide of respiratory illnesses, enacting measures to curb its spread and treat affected individuals. From increased testing and surveillance to the development and distribution of new treatments and vaccines, The global response has been swift and comprehensive. In some places, restrictions on public gatherings have been reintroduced, while others have increased their focus on public health messaging, emphasizing the importance of hygiene practices and wearing masks. Telemedicine has also seen a surge in use, providing a safe and effective way for individuals to seek medical advice without risking exposure. On the research front, scientists are working tirelessly, studying the virus to better understand its behavior and how it can be effectively controlled. International cooperation is at its peak, with countries sharing data and resources to bolster the collective fight against this illness. As we navigate through these challenging times, staying informed is our strongest defense.